to our Ireland Portugal Business Network Health Seminar. Today we are joined with Dr. Paulo Sousa from HPA, Desmond O'Neill from Allmarket, and Shane Farrelly from Some Armed. Sorry if I got
Some are med.
Some are med. Sorry, Some are med. And obviously myself, Carolyn, from the Algarve Committee of the IPBN, and obviously from Shebang PR. Today we're really going to discuss the health systems, both in Portugal and in Ireland, the benefits, the restraints, and if you are looking, two aspects. One, if you're going to look to move here, what is the best way and the methods to get the best out of both systems, and also as well if you're on a waiting list looking for surgery, the benefits of having that done in Portugal. I myself have actually experienced both systems. A couple of years ago I took very sick with my stomach, and I actually went to the private hospital in Portugal because I happened to be here at the time, and like I say, I was very sick. And within 24 hours of seeing a doctor, I had cameras up and down to see what was wrong with my stomach. Literally that evening, diagnosed with Crohn's disease, given medication that evening, and then the doctor suggested that he wanted an MRI scan, because obviously there's a part of the bowel that you can't see. So within 4 weeks of that, I had an MRI scan in Portugal. All of my test results were sent straight to my doctor in Ireland. But on the MRI, it actually appeared that I had an epithelial tumour, ovarian epithelial tumour, which was growing on my pelvis down into my ovaries. Now, the bonus of that MRI was it would never have been caught without the MRI, because it is known as a silent killer in women because it's not detected on any normal tests. So literally, I had that scan on the 5th. My results came in, and Portugal were actually willing to do the surgery in the July, start of July. So very, very quick process. Obviously, the doctors here suggested I spoke to my doctors at home. The NHS in Ireland were actually willing to pay for it in Portugal. But the NHS obviously gave me the opportunity if I wanted to fly home and have it in Ireland. The pros and cons for that for me was mainly because of the language. Obviously, it was a bit of a shock. Didn't know what was happening, didn't know what was going on. My tumour actually grew from 9.8 centimetres to 57.8 centimetres in the space of that 2 months. So it's quite an aggressive tumour. So my personal decision was to have it in Ireland, simply because it was the unknown. But 3 weeks after my surgery, I came back to Portugal, had my post-care here, and all my follow-up care in Portugal. So for me personally, but obviously both systems were very fast, very effective, very efficient. And obviously I'm still here today because of it. Now, obviously I went down the private route in Portugal simply because I'm not a resident in Portugal, and therefore I do have private health insurance in Portugal, so I went down the private route, and then obviously on the NHS route when I was at home. So for me, it was a perfect system, no delays. Literally from the 5th of June to the 19th of August, I was in and out of surgery and everything done, which is a very big reassurance, because it was life-saving. You know, if that tumour in me had burst, literally I would not be sitting in front of you today. So there's sort of different aspects that we want to touch on today. Obviously, everybody has a different story. Everybody's in a different situation. But first of all, maybe if I can come to Dr. Paulo, just sort of, can you explain, I mean, for me, obviously, that was a very easy, very rapid process. So for example, if people didn't have a private health insurance here, how would they go about that?
Well, Portugal has been changing a bit the way the medical system was organized over the last 10, 15 years. We were mainly a country with a national health system, which was up to, I would say, 20 years ago, was giving some good response to the general population. But in the last 20 years, unfortunately, we have been watching a reducing of investment from our government into health. Not just because they are investing less, is also because costs are becoming higher and higher, and we are not being able to keep the pace with that investment that needs to be done. So unfortunately, what we're watching is that the general response from the population is been decreasing a bit in the public system, and that's why the private system is growing so much in the last 15, 20 years. Now in Portugal, there are as much as private hospitals as public hospitals. So we have about 218 private hospitals and 220 public hospitals, which makes it quite half-half. So I would say 50% of the population in Portugal now has some kind of private insurance, which helps to solve their medical problems, like you did. And about half the population doesn't have private insurance, which makes them the need to go to the hospital. The system in Portugal is partially free. So if your income is low, you don't pay anything in the public system, not for an appointment, for a surgery, and in some cases even for medication. But the majority of or if you have a chronic disease that you need to go constantly to the hospital, also those type of patients, they don't pay almost nothing. But the majority of the population would have to pay some kind of fee going into a public hospital. The big problem is the waiting list. Even for a GP appointment, sometimes you have to wait 1-2 months before you can get to the GP, and then from the GP to the specialist in the hospital. Sometimes that can take a few months, or sometimes longer, sometimes years, depending on the medical problem. And if you need a test, or if you need some kind of surgery, that is also a long waiting list in the public system. So that's a bit why the private system has been growing here in Portugal a lot.
Do you see that over the next maybe 3 to 5 years, everybody will go down the private or have some sort of private insurance in Portugal?
Yes, if you see the figures from the insurance companies, you can see that they are growing year by year, and they're growing two digits, so more than 10% every year. So that is rising a lot. The question that patients, unfortunately in Portugal, they feel that they must have some kind of extra coverage in terms of health. And the degree of coverage you have, you can go very low just from a simple plan that helps on getting a medical appointment on a specialist, up to more complex plans that cover for surgeries and have a big plafond to spend on health every year.
Perfect. Obviously now in between Portugal and Ireland, Southern Ireland has got what's called as the GMS. Obviously the north of Ireland is under the NHS, and Portugal is known as the SNS.
Yes.
Dan, can you explain to us what the Southern Ireland GMS, what that system works, or how it works really?
The GMS stands for the General Medical Service, and that applies to general practice mainly. There's the overall Department of Health, which governs the Health Service Authority, and then there's the GMS, which decides on your eligibility for GP access, free drugs if you're eligible. And the criteria normally is income. So you get they have a GP card, which makes you eligible to see GPs. It's under the GMS, and if you're of a different income, you get also free drugs, and gives you access to the hospitals. What I have found, having used both the systems, is that the access to healthcare here is quite easy compared to Ireland, in that it's difficult to see, it can be difficult to see a consultant. And it depends on who you want. There's different specialities in different hospitals, and it can be quite difficult. But outcomes are equally as good in both countries, I find. But I find here the access is easier. The insurance schemes are more transparent and easier to follow. That the healthcare or the health insurance in Ireland is quite complicated. You can buy all sorts of options in, options out, and there's different schemes. And the insurance companies change them every year. And the different insurance companies obviously have different schemes. So every year you have to review your policy and review the other policies and see which one suits you best. Okay. So I find here the insurance is quite straightforward. The plans are less complicated or confusing. And once you're eligible, then it's quite clear how you avail of it. So
Okay.
generally, I would.
In the north of Ireland, obviously, there's the NHS system, which again is if you have your medical card, and obviously based on earnings. Basically, you can go and see a doctor for free. That doctor will then decide whether you need to see a specialist, and then obviously you're put on a waiting list. Now, the big problem that we have is the length of them waiting lists, even to see a specialist, and then obviously what treatment you need on from that. Obviously, the benefit of having the private care is that time frame is dramatically shortened. As regards the Portuguese system, Dr. Paulo, I think that's pretty much the same as here, isn't it? It's your waiting list for non-essential surgery is the big problem with
yes. Yeah, the waiting list is a major problem, and now. Especially now after COVID, because during the last year, there was a significant reduction in the hospital productions. So majority of the public hospitals, they shut down a lot of services, from operating theaters to ICU to non-emergency procedures. So actually, we don't know 100% exactly how we are now, because there was a query that we did on general population. Unfortunately, we were one of the worst countries in Europe regarding medical assistance on non-COVID patients during the last year. So we focus a lot on COVID, and all the majority of the hospitals, they have very good plans on response on COVID disease. And but the rest of the patients, it was a big problem, and I think the waiting lists are quite big at the moment. For instance, for a cataract surgery, I know the waiting list is around 2 years now. It's very long.
Portugal is currently ranked 12th in the world for healthcare, and Ireland actually slots in there at number 13. Dr. Sheehan, if I can just maybe ask you, because obviously you work in different countries with different healthcare systems as well, do you see a big difference in Portugal being 12th and Ireland being 13th?
No, not significant. I think that the key, so it really means that they're both comparable. So from my perspective, I suppose there's two parts. One, living basically in Portugal for the last 3.5 years, and accessing basically the healthcare system, I'd say it's actually very similar to the healthcare system in Ireland, and you can certainly access basically doctors who will speak English. And the quality of the service is excellent. And again, it's about the delays. So my past history was a GP in Ireland, basically about maybe 25 years ago. So I've got both aspects. And then as an occupational health specialist, but my role is basically when companies are coming into a country, that to make sure they've actually got the supports that they basically require basically for their employees. So I see it kind of from both ends of it. So my sense is that I actually feel that the outcomes within Portugal are as good as they are basically in Ireland. And your experience, of course, highlights a lot of that. And the second thing is that, you know, the system is quite similar. You've got your GP, then you go back to your consultant, although the only difference is that whereas in Ireland, you must always basically get the letter from your GP, even privately, to go to the consultant. My understanding, Paulo, is that you can actually go yourself to the consultant directly in Portugal without the GP referral. Isn't that correct?
Yes, you can. Yes, you have a private, in the private system, you can book directly to any doctor you want. It's a free of choice, and you don't have to go through the GP to go to the consultant.
I think,
one thing, just do my apologies to follow that piece. One thing I would see a lot of basically as an occupational doctor is how you look at rehabilitating people back into work if they've been out of action for some time. And there really is a good rehabilitation type service basically available through the hospitals basically across here on the private side, with excellent access to physiotherapists and also for mental health supports as well.
Yeah, I think there's three sort of very significant aspects to to the healthcare systems in both countries. And first of all is obviously the main health state system, which, like we've talked about, is the GMS, the NHS and the SNS. And obviously, whatever country you want to reside in, it is highly recommended that you join that system. So for example, if you want to move and live in Portugal and work in Portugal, you obviously register with once you become a resident to get your SNS number, and then you're obviously, I've got access to that. So if you just need to see a doctor, you know, for a common cold or something less significant, obviously that access is there. The other side, and I see a question here from Eamon and Olive, which we are going to touch on, for shorter stays, the European health card obviously comes into play there, which gives Irish citizens, for example, if they need emergency medicine in Portugal, the European health card comes into that, and that's for stays up to 90 days. So as long as you obviously have travel insurance and everything like that, your European health card will be accepted in the public hospitals. The third option is to look at private health insurance, which then gives you in both Ireland and Portugal that extra reassurance. Now the Irish, like if you're with Bupa or Aviva or something like that, is accepted in Portugal. You don't have to take Portuguese health insurance. The worldwide ones are actually very much accepted here. And as Dr. Paulo said, you simply just have to pick what type of doctor you want to see, when you want to see him, and where you want to see him. It's a very simplified system. Now, the other side of that coin is, let's just say you are on a waiting list, say for a hip replacement. Portugal is a very, very good destination, obviously, to have the treatment, to have the rehabilitation. And I do know that there is actually resorts being opened up specifically for that health and wellness aspect. Now, if you have been on a waiting list for a long time in Ireland, the actual Irish government, depending on obviously the length of that waiting list and the severity of what you need done, will actually approve your surgery to be done in Portugal. Like that happened to me because mine was an urgent case. They were actually happy for the NHS to pay Portugal to do my surgery. And obviously that can be done in a private hospital as long as the documentation and everything is done beforehand. So there is a lot of reassurance there, you know, of what can and can't be done. But I think as regards waiting lists, Dr. Paulo, if you were, like I say, waiting for a hip replacement or non-essential surgery, if you like, how quick can people get that done here?
Oh, well, I would say in a week and a half. It's a question of, and sometimes shorter, it's a question of seeing the case. And if someone sends us the tests in advance, we can program everything. And normally what you do, the pre-op tests in the previous day. If he needs to be checked by any other specialist, we can get the appointment on the same day, and we can program the surgery in 48 hours after arriving in Portugal. We have done already that in several times, and there's a lot of patients that looks for our group to do some kind of medical tourism. Medical tourism in the Algarve is very used, but it's a lot used by residents, by temporary residents, which have a house here, spend some time in their own countries, but then they spend a lot of time here. And we have a lot of protocols with different hospitals and different areas, like in cancer, for instance. There are a lot of patients that live in Germany, Holland, other countries, and they get diagnosed from a tumor. They need 6 months of treatment, and they decide to come and do the treatment here with us. We use the same protocols. We have a good connection with their own doctors, and they just enjoy a bit more, and they have a more sunny place to be doing the treatments than sometimes where they ordinarily live. And it's the same protocol, same medication. The follow-up can be done by both hospitals, and it's quite quick and fast and simple to do for everyone. For surgeries is more or less the same, and we have a system that allows the patient to bring all the medical data with them, and they have even access to the entire test when they get to their own country. And the big difference between doing a surgery outside a country and looking for medical practice in another country, I think has to do with the assurance of the quality of the service you're going to get, and also on reassurance. If something goes wrong, you have the possibility to have good quality of teams to deal with complications. Unfortunately, medical practice is never. You can do your best, but there is always a mild risk of something going wrong. And the big problem is when something goes wrong. If you have if the hospitals have really the ability to take care of that, and also if there is a legal aspect that is surrounding the medical practice that makes all that reassurance and fair for patients and doctors. If you go, I don't know exactly in a lot of countries, but I imagine in Turkey and in India, if you have a medical problem there, I don't know how it can be compensated from that, and if something goes wrong, how you get it. That's one of the biggest risks of going to some of these countries that do medical tourism that have a different law than European law. That's from my point of view, at least.
Yeah. And my apologies, Paulo, if I can just interject, I think the audience might be interested in this from our previous conversations. One of the big difficulties I know that people have if they go to a private hospital and they get a complication, what happens? And I think the point that might be referencing is the fact there are intensive care unit beds for the complications, and maybe to talk people through what happens should a complication arise, which can happen with the best surgeons.
Mm-hmm. Yeah, I think, just on that, Dr. Paulo, we discussed this earlier. How do people choose a private hospital over here? Because obviously there is different options, and obviously there's pricing to consider. There is the care, the level of care, the level of expertise. Obviously you work for the HPA Group. What do you sort of surmise would be your advantage over the other private hospitals here in Portugal?
Well, I think that we have good things and bad things, like everyone. I would say the biggest advantage is that you have a fully integrated system in the Algarve and Algarve, Alentejo, and Madeira region. So we are a group of hospitals which are basically based in the south of Portugal. So we have 3 hospitals in the Algarve. We are opening this week a new one in Alentejo, in the coast, in Sines, which will cover all the coastline from Setúbal to Sagres. And we opened 2 years ago a new hospital in Madeira. So basically, choosing HPA Group gives you access to an integrated system between hospitals and small clinics. We have about 16 small clinics which work closely to do where the majority of the population lives in these areas, and gives quick access to a GP or to a medical specialist in those clinics. So they are proximity centers, and which work fully integrated with the hospitals in terms of medical files, sharing tests and information. Also, you can get your own medical data on an app. So actually, all the patients, they carry with their own on their phone or their medical file. So even if they want to go to a different hospital than ours, they can take their medical file and show it to anyone that they want, if they want to have a second opinion, or if they want to go back to their own country. This is something that not all hospitals do. The other advantage with us is that we created a system that basically covers for all types of medical needs. We have 2 ICU units in the biggest hospitals in Alvor and in Faro, with about 14 beds at the moment, which is more than enough for our needs. And you can do almost all types of surgeries, from open heart surgery to minimally invasive with cardiac minimally invasive, and head surgery, brain tumors. We have a very large team, and we have about 760 doctors working with us at the moment.
Oh.
So it's quite a big team. Not only doctors here from the Algarve, we have doctors that come from some other countries. We have one of the most known thoracic surgeons in the world working with us, with Diego Rivas. Is one of the guys that has invented minimally invasive surgery for lung surgery, and he works here with us. And we have a lot of doctors coming from Lisbon and from Porto with very good expertise, which was a big problem in the Algarve in the last 20 years. So I would say we have a full integrated response system that can give you any kind of answer anytime, and without the need to be transferred to another hospital or to the public hospital if something doesn't go as well. That's a big difference from these hospitals to the other hospitals, because and none of the competitors has ICU units. So the only hospitals with the private practice that has ICU units, it's our group.
Okay, just before I kind of switched a little bit on the subject, Dr. Paulo, if you're obviously under the Portuguese state health system and you are taken to Faro Hospital, for example, you do have the option to switch to private, don't you?
Yes, anytime. It's your option. You don't. The emergency system actually works quite well in Portugal. We have our 911, like in the United States. Our emergency system, it works quite well. It's but the biggest problem with our emergency system is due to legislation. They are not very fond of bringing patients from emergency to private hospitals. So normally, if you call the emergency number, they will take you to a public hospital first. And sometimes if you ask to be taken to a private hospital, they do. But the majority of the times, if you're not in condition to make a decision, they will take you to a public hospital. And then you have 2 options. You can stay there, or if you feel that it's not going okay, you can always phone us. And we have 3 private ambulances to go and pick up patients whenever it's necessary. So we can send our teams with the nurse or the doctor if it's necessary to go and pick up the patients from wherever they are. We can go and pick up patients on their homes if they need, or in the hospitals. We cannot take patients from the street. For instance, if you fall on the street and you call us for an ambulance, we cannot go there because it's forbidden by law, and that has to be done through the emergency system in Portugal.
And the current trends, I mean, it used to be if you went into a private hospital and then switched to, went into a public hospital and switched to private, you would probably 80% of the time see the same doctors or the same surgeons. Is that trend changing now?
Yes. In the last 10 years, what's been happening is that there's a lot of the most experienced doctors, unfortunately for the national health system, have been changing to the private system. I worked 20 years in the public system, and about 13 years ago, I changed for the private system because basically of inefficiency. And if you are someone who's willing to work and wants to do a nice job and try to do a nice job, it's very hard, because you get for instance, I used to work in a hospital in Lisbon, which at the maximum I could do 3 surgeries a day. I could not, because there was always something missing. There was always something that didn't go right. And so that the inefficiency of the system is quite high. The doctors are good, the nurses are good, but the general system and the organization is not working as good as it should. And because there is lack of investment, sometimes it's not easy for the hospitals to get access to some instruments, some medication, some technology, which makes working in the private system much more appealing for doctors. So that's why in the last years, majority of the doctors, they have been changing from public system to the private system. Also because of course, economically is better to work in the private system than on the public system, which also is more attractive for doctors to leave the public system.
Okay, Dr. Sheen, if I can just come to you. I mean, you started out as a GP, but obviously your preference was occupational health. Can you maybe explain the difference in the two types of you know, obviously, as you explained, a GP has to be a general practitioner, whereas an occupational health is slightly different?
Yeah, so I suppose the difference, between that is that a GP is subjective. So of course, when you go to your GP, you're explaining your situation to them, and they understand that everything there is perfectly obviously what you say. An occupational health specialist, and of course, we've all probably come across people in my specialty about fitness to return to work. So we kind of have to look at the objectivity, and also to ensure that you go back to work safely and that accommodations are put in place. So a lot of what we would do is basically look at helping people's mental health, protecting them so they've got the appropriate supports to go back, particularly at these very difficult times in the middle of COVID. And then also basically if people have got physical issues like back problems, that they have the appropriate supports when they actually go back, that maybe their hours can be modified. So we're kind of that support. And I think what we do a lot of risk assessment and risk evaluation. So I think because risk assessment and risk evaluation is actually part of our remit, that's why we've really come into a fore in relation to COVID, myself and colleagues like me. But also the other issue basically is that if an organization is going into a country, and as you mentioned earlier, I have a footprint in some other countries. So one of the things we're prepared to basically maybe to Brazil. Brazil have got an excellent system in health, but it really is around the private system. So in Sao Paulo, there's actually an Albert Einstein hospital, which is world class. I also basically support organizations that are in Mexico. But again, you're very much in the private system. So looking at the comparisons, I would sort of say is, you know, if you are brought in as an emergency into a public system in Portugal, you're really going to get very good level of care, but just like you actually will in Ireland. Well, it's about the delays, and it's about if you go to A&E and you require a further evaluation or further assessment, you're sent home, and there's the waiting list that Paulo referenced, which I think is actually quite unique, basically about the Portuguese system. So as we know in Ireland, should you go into Dublin, basically into A&E, they ask you if you've got healthcare insurance. They take basically your healthcare number, they invoice the VHI, Irish Life, or whoever it actually may be, but you get the same treatment. Whereas in Portugal, what happens is that you've got the option to go privately, but then you move to the private hospital where you actually get a different level of service. So I think that is kind of maybe a bit of an overview. And because rehabilitation is such a focus for me, both in mental health and also in basically musculoskeletal type injuries, one thing I've actually noticed from my research is that is equally available basically in Portugal, and maybe even more readily accessible than it might even be in Ireland.
Now, just on that, obviously we've talked very much on a personal point of view. On a business point of view, if you're going to open a business here or bring your company, I know you've worked with Amazon and things like that before. If people were going to have a startup business here in Portugal, what is it your company does that would obviously assist that, or on the medical side?
Okay, so what we basically do is make sure that basically they are compliant basically with the health and safety legislation. So they actually are coming up and opening up, so they understand basically what the rights of the employees working in Portugal should be. They understand that they've actually got an appropriate safety statement in place, so as they can actually make sure all their employees actually return from work safely. And then looking at the processes, so the things that we look at is putting in the protocol. So do you actually have what sort of mental health protocol do you have? Do you have an EAP protocol? And it varies on the size of the company. So a very large company coming in, like the likes of Amazon, they actually want to make certain they've got a very large support. They'll have a global network, and it's a question to make sure that actually is patched into the local aspects in Portugal. The small companies coming over, maybe about 5 or 7 people, well, they certainly want to make certain that we actually are fully compliant in relation to the employment legislation aspect as it relates to health. That's one of the aspects we help them with. And then if they have people who actually require treatment as part of that rehabilitation, like accessing a physiotherapist or accessing some mental health support or whatever, that is the part that we would actually have guide them on.
How do you see the mental health situation at this stage of COVID?
Oh, I think it's become very significant. So that's something which I would see myself basically on a very regular basis. So they were talking about that there's probably been up to about a 60% increase in mental health related issues. The big difficulty is that with the varying levels of lockdown, of course, Portugal is just coming out of a quite extensive one. But of course, in Ireland, that's really been very, very difficult. And particularly if people were actually living in a small apartment, they were trying to juggle looking after a young child and do their calls. They found this extremely difficult. And one of the things that we actually would now do in organizations is we actually help to train the managers to recognize the early warning signs of stress so they can refer into me or my colleagues at an early point so we can make sure that the appropriate supports are actually put in place. Because a lot of the problem is that without the intervention, people just go to burnout. So they actually are stressed, they don't fully aware of that. And then they actually go to a burnout situation where they just really can't cope at all. They can't manage their processes. And of course, one of the big things in work is that people, if they're not performing, go into a personal improvement plan. So before they go into the PIP, we need to make certain that they're well enough to do that and look at what the reasonings are and make sure the support is. But mental health has become a significant issue. The other issue that has happened, which I know it is being addressed in organizations basically for health and safety, both in Ireland and of course in Portugal, is really making certain as you carry out the home risk assessment, because we're a year into this. So when people are working to their own office, they're used to actually having their health and safety guy have a look at the workstation, make sure it's appropriate, they've actually got the right chair, they've got the right distance, etc. But we're seeing a lot more sort of injuries and people's strains in relation to risks, etc. Because literally what was happening in a lot of cases, people went home a year ago with their laptop, they popped it up on the kitchen table, sitting there, and they have been actually working significantly. One of the other things, there's a recent study done in the States, and what they showed was that people in general are now not taking their lunch break. So as where in the past you had some relaxation depending on traffic when you commuted, now you're still working those hours, but you actually are not taking the lunch break. So the one thing we've been talking about people is making sure they take their designated break. So I would think, making sure home risk assessments are done, and then keeping an eye, because you've got the same obligation for your employees where they're working at home from a home office, which of course is the requirement from the government at the moment, where possible, to continue to work from home.
Dr. Paulo, just to come to you on that, from a medical, obviously working in the medical sector, has there been a mental health issues are wrong words? Do you see a more strain in mental health as regards you and your employees with the pandemic, and obviously the urgency still to do surgeries to continue, but obviously you've got this pandemic as a major strain on top of that?
Oh, well, yes. I think basically the biggest problem was in the first 2-3 months when we didn't know how this is going to happen. Everyone was very scared. I remember myself. I never stopped working. We were doing surgeries even through the peaks of the COVID spreading outbreak. And I remember going home to my wife, and one of these days I cried. You know, I was so distressed and so afraid, and because we were getting all this information from Italy and from Spain, and it was so terrible, so many doctors dying, so many people dying, and you could not understand exactly how it was happening and how it would be when it got really hard here in Portugal. So we were very scared, and everyone was a lot of doctors we didn't want to. They were really afraid of coming to work. And there were doctors that would only work with completely covered with masks, and they would look like aliens going into the office. And we were really scared in the beginning how this would happen. We never closed the any of our facilities. We had been open all time, never closed the emergencies. We kept everything open, and we didn't close any service. But then, as time was getting through, and we realized how things were working, we understood better how to protect ourselves, how to protect our customers and our patients. We created a system of very good, very efficient system of triage, which helped to recognize the symptoms of the patients and put them in clusters and have them treated on the patients on the exact place. So we could not mix patients with symptoms with non-symptomatic patients. And we actually feel that we did a good job in there. And that helped also the population and our staff to understand how to behave, or how to prevent the outbreaks and how to control. We have been investing a lot in testing and trying to test our staff and our customers and our clients in a regular fashion. And doing that allow us to keep being a non-COVID. We decided to be a non-COVID hospital throughout the process. We created a COVID hospital where we would transfer all the patients with symptoms and with COVID disease, and we tried to keep 2 other hospitals in the Algarve as non-COVID, because we felt that the biggest problem was trying to get access to medical facilities if you didn't have a COVID disease and you still needed to go to a doctor. It was being very hard for patients in the Algarve. And also because the public system was not crowded, and we through all the process we never reached the full capacity of the ICUs in the Algarve. So that was a very good thing, and we actually received patients from other parts of Portugal. So that allows us a bit of margin to keep treating non-COVID patients. Although we have seen a lot of COVID patients in our hospitals, the only thing is that we didn't admit the patients in the non-COVID hospitals. So that allows us to keep the non-COVID hospitals safe, and they are still very, very, very safe. Okay. The doctors, they feel safer now.
Yeah, in regards to obviously going a little bit back to non-essential sort of surgeries, I mean, does HPA Group provide things like occupational health, mental health support, you know, that sort of aspect that are still health issues but are not deemed as hospital related?
We a couple of years ago, we created a unit that does basically mental health, and we refer all of our patients to that unit. It's in Sombrage. It's a bit above Lolé. It's a very quiet region, and it's very, very comfortable. And we created a mental health unit with 11 beds. It's not very big. It's very small, very cozy. And so because we feel that mental health, it has special needs and special care that sometimes it's hard to do in the middle of an acute hospital. So we created an area which is very comfortable, very, 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 very pleasant for patients who need some kind of mental support. and if there is some mental disease associated. And we also created, if there is some other patients who just are not sick, but they want to recover from all of these, and they want to rebalance themselves. And we created a new unit last year, which is called Longevity Hotel. It's a health hotel. So basically, it's a hotel with 100 beds, but is very directed for rehabilitation in all aspects. So mental rehabilitation is very important for our staff in that unit. And you have everything from yoga, from coaching, from all types of support if you need to get some help in that area also.
Perfect. Des, if I can just come to you. How does the, you touched earlier there on private Irish healthcare. How do you find the cost comparison between the Irish private healthcare insurance and Portuguese private healthcare insurance?
Sorry, can you repeat the question?
Sorry, to Des. Yeah.
It's not for me.
No, sorry. The price comparison in the Irish private health insurance and the Portuguese, Des.
Well, I guess have been subscribed to both. I think the premiums in the Irish Health Service are very expensive. They really are. And you can pare them down, depending on all the services you want. But I would say, compared to the Algarve here, the premiums for private healthcare in Ireland are probably double what they are here, I would find.
Okay. Do you know?
The one I have here is a premium.
I was just going to say, which one do you actually have here, Des?
I'm with Allianz, and I have their premium. And it's still half the price what I was paying in Dublin.
Okay, and that gives you access to everything in the private sector here?
Everything, yeah.
Okay.
Surgery, yeah.
And in regards to your line of business, the consultancy to pharmaceutical and healthcare companies, what stands out about the Portugal healthcare system for you, and how does it compare on the pharmaceutical side?
Well, with the pharmaceutical companies, it's what I do is I deal with the major pharma companies. So I would be helping them write protocols for clinical studies. So it's not really affected. I mean, these clinical trials are going on all the time anyway. So protocols have to be written. What we wouldn't do now is market research to the same degree, because you need to know what the patient thinks as well as what the doctor thinks. So we can do some of it online, but while the research is still going on, it's writing the protocols has changed quite a bit. So that's the only way it would have affected, but that has no direct impact on the consumer. That's just between the medical profession and the pharmaceutical companies. So they just, when we help them design the protocols for their studies, identify clinicians who would be appropriate for conducting the studies, and if appropriate, monitor the study as well.
Okay, so, Dr. Sheehan, from a business point of view, Dr. Sheehan, from a company point of view, do you find private healthcare insurance for company side value for money?
Yes, I think that would be the feedback that I would actually get from the organization, because the larger organizations have actually got their own division that actually looks after that. So the things that I would be actually giving them is saying, look, this is what is, so they might say to me, look, this is what we may have in the US. what is comparable basically to that. So I'll give them guidance onto that in relation to the plans, like the premium plans Des was saying, and they will come back and they'll find the big thing is there's not a lot of hidden extras, and probably no hidden extras, I think is probably fair to say, in the Portuguese system, whereas the other system is all about have you got the right add-ons for what you require on a given day.
Okay. Dr. Sousa, just to come back to one point with yourself. So basically, if somebody is on a waiting list in Ireland, okay, and they're waiting for any type of surgery, what is your best advice for them moving forward?
Well, we just go to our site. There's a part of the site which is dedicated to medical traveling. Or you just can send us an email to our email in the hospital, and someone will take care of it immediately. We can make a video appointment with the patient still in Ireland, and check all the details and the personal data, and enlighten any questions, any doubts that the patients have. We can discuss the costs, and we can even send a pre-invoice if they need to check with Ireland if they are covered there, and they can know how much they can get covered, or if they get full covered for their treatment. And it's just a question of coming to the Algarve, and we arrange it. It's no waiting list. We also have facilities that help with rehabilitation. There was someone asking that a few moments ago. We have the hotel, the Longevity Hotel in Algarve is next to the hospital, so it's 50 meters from the hospital. So it's a very good place for rehabilitation. You don't need to stay the full time in the hospital. We can spend 2-3 days in the hospital and then finish your rehabilitation in the hotel, in that hotel or any other hotel that you want. We have a physiotherapist team that can go to where you're staying and help with the rehabilitation. And so it's not complicated at all. It's a question of trust. It's a question of having the mind and the ability to go and look for a treatment in another place. Portuguese doctors, it's not because I'm a doctor, but they are very well recognized worldwide. And the standard medical practice in Portugal is quite good. We have state of the art technology that exists in the majority of the hospitals in Europe. We are now planning here during this year to start robotics technology also in the Algarve. We're going to be the first hospital doing that. And we are already doing some robotic, but not with Da Vinci, but we will have it in a real short base. And so basically it's not complicated. And the good thing about is that majority of Portuguese doctors, they speak English quite as a second language and very, very easily. So the communication barrier is not so big. And all our staff speaks English, from nurses to physiotherapists, everyone. So it's quite easy to communicate and to deal with that barrier.
I think that one of the important things to highlight really is something you touched on there, the expertise of surgeons in Portugal. I mean, when I had my surgery, I actually, my right pelvis is actually now fiberglass. And the 4D images and everything of people were showing me of actually how that is done was phenomenal to me.
Yeah.
I mean, how can you literally just take out part of a pelvis and reconnect it, you know, so that I have full movement. Another option of it is, do you know what I mean, even down to like liver transplants and things like that, and heart surgery. Portugal's doctors are renowned as probably, if not the best in the world, certainly up there in the top 5.
Yes, in liver transplantation, we are in Europe. We are we have the biggest centers in liver transplantation in Europe. We have 4 very good centers of liver transplantation. But in heart surgery, for instance, and in lung surgery, Diego Rivers that works here with us is probably one of the most known lung surgeons in the world, and there are patients coming from all around the world to get operated here with him, and in many other medical areas. Orthopedics, we have a very good team of orthopedics, and they developed a system for knee replacement, which is fantastic, because what they do an MRI first on your knee, and then they buy they order a hip knee replacement, which is made specifically for your knee. So it's pre-tailored, and the results, the outcomes are much better than if you use a general prosthesis for a general knee. So it's basically tailor-made, and the results are fantastic. They have been publishing it in the medical magazines over the last 5 years, and the results are quite fantastic. The rehabilitation is quite fast. The patient normally doesn't stay more than 1-2 days in the hospital after a knee replacement, and they leave walking by their own after two days. It's 2-3 days, and no blood loss. It's very good result, and I would say that's one of our so we do a lot of things, but this one it's incredible, and the results are fantastic.
Dr. Shane, what would from obviously from the Irish side, the Portuguese side, and obviously in other parts of the world, what do you see the main advantage of Portuguese health system?
I think the main advantage is that the fact that you can actually access quality care, and you can do this rapidly, and there's actually excellent rehabilitation in place. Because I think even in the Irish system, rehabilitation can be an issue, access to rehabilitation. So obviously the care is excellent in Ireland, but the waiting lists, access to the rehabilitation is difficult. I know, for example, within Ireland, the sports injury clinic will do an awful lot of the surgery on the orthopedic side. They have the whole rehabilitation side there, which does work very well. But I think you're talking about is, I think that the important thing for people to understand is that, look, the quality of care is actually really as good as you would actually get in Ireland. The rehabilitation is as good, but the system that you actually get through the process a lot more quickly. And then I think the other aspect is that your health insurance kind of covers everything, and it's actually cheaper than the health insurance that you would have basically in Ireland.
And I know obviously from companies' point of view, you actually help people to relocate their businesses abroad, and obviously set up that whole process. Anything you want to touch on there before we finish?
Well, I think the key aspect is like what we would always do in that situation is basically simply do a needs assessment. So basically find out what number of employees were coming in, what area they were, whether they were in manufacturing, whether they were in retail, what were they doing, look at what the requirements were. So based on that needs assessment, you can determine what the requirements are to make sure they actually are completely covered from a legislative perspective, from a health and safety piece, and then basically in relation to looking at what particular benefits they want to actually give their employees around the healthcare, and of course make sure that they do basically have their European health insurance. They're coming from Europe. And I think one thing as well too is there is a very good link on the Ireland Portugal website, basically talking about the ins and outs of healthcare in Portugal, which is probably a link people are worthwhile having a look, because it may answer some of the questions or queries that they actually will come up with, or indeed basically on the Department of Foreign Affairs website as well there too. They talk about that and how you actually get your European health insurance card, etc., all which you spoke about earlier.
Yeah, and Shane, anything, do you want to just leave your contact details maybe in the chat box there, so if anybody does have any questions, if they can contact you directly, and obviously if you are thinking about moving your business over or starting a business here, Dr. Shane can help you with that, and also on the occupational health side, and I know he's available if any of you have any questions. Dr. Paulo, just a quick questions come in here. What about sports injuries? Is there a specialist hospital or clinic?
Well, all of our hospitals are able to treat sports injury, but the basic aspects, of course, surgery and sometimes treating these acute injuries is important, but rehabilitation is a key factor, like Sean was saying. So we have in Vila Moura, we have a very nice team of sport rehabilitation, which works a lot with golfers and with Vila Moura is a resort in the center of the Algarve, and where sports practice is very, very important. We have now the majority of the Olympic sailing, one or two. I don't know. I'm not a sailor. I don't know which category are training there, but there's a lot of Olympic teams practicing there. I actually have admitted in the hospital from an accident the coach of Italy now. So there's a very nice clinic dedicated to sports rehabilitation that we have in Vila Moura, because that's where we decided that it would be better located. And the surgeries can be done in any of our hospitals, but rehabilitation and all the process of getting back into sport is done in this clinic in Vila Moura. I would just like to add something to Shane's. In Portugal, if you have a private company, the medical costs regarding insurance is fully deductible on your taxes. So you can provide that to your employees, and still you pay less taxes if you do that. So it's a good point. There's a lot of Portuguese companies which are offering the medical insurance for their employees. The majority of the companies, they all offer the insurance, the health insurance plan for their employees, because of two things. One is because they can deduct that in taxes, so that's good. And because they understood that if they offer the medical coverage for their workers, they will stay less time away from work, because they would not be waiting so long from the national health system. So they found out that that they would pay a bit more, but in the long term, and on the analysis of a full year of work, they will have much less days out of work for their staff, having a private insurance plan, than just waiting for those workers to get treated in the national health system. I don't know what you feel about that, James.
No, yeah, absolutely. It actually is very good, because I think the big aspect that, as an occupational health doctor, of course, is one, you want to protect your employees, but you really want a valuable person to get back to work as quickly as possible. So basically having that access basically to the health insurance is very effective. And I think when compared to the Irish system, whereas companies can pay the VHI boom or whatever, basically to organizations, the difficulty is that they can't guarantee that just because you have that insurance, you're going to access the treatment more quickly and therefore return to work more quickly. So absolutely, fully agree, a point I forgot to mention. So thanks for pointing that out.
No problem. Des, anything you would like to add?
No, well, I'd just add to what Shane said. If your company pays for your health insurance premium in Ireland, it's deemed benefit in kind for the inland revenue, and you pay tax on it. It's the other way around, unfortunately.
Okay. 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 There's a lot of people asking here for a list of private healthcare companies in Portugal, insurance companies. I think Arnold maybe can put a wee list together, because there is a wide range. I think maybe Nuno, if you're there as well, maybe you could add to that list to sort of see what HPA works with specifically, because I know different private health insurances don't always work with all private sectors. So maybe
there's
we'll get that.
Agent, Caroline, there's a good agent in Portimao, Medal, which HPA would know. Okay. And they act for quite a few of them.
Yeah, I think with everybody that's been on today, we'll certainly get that list sent out via email, just to give people some guidance, both from a company side and obviously a personal side. Obviously, if you are looking to move here, make sure that you get registered with the SNS, obviously for public, sorry. Look at your private health insurance. If you have private health insurance in Ireland, it could well be that you're covered in Portugal and the rest of Europe. And if you are looking at just coming, if you're not a non-resident and looking just to spend a few weeks in Portugal, obviously do get your European health card, because that is covering you for state healthcare should anything happen or go wrong whenever you're on your vacation or your short work trip. Can I just say thank you to all of the panel, Dr. Paulo, Dr. Shane, Des, for a great insight into the different systems and obviously what can and can't be done. I think it goes without saying that the private healthcare system here in Portugal is without a doubt one of the top in Europe. And as I say, I know from my personal experience, life-saving and life-changing really.
Yeah.
So I obviously, as I said before, I have both. So I would certainly recommend, do you know what I mean, that people look into that. Peace of mind goes a long way, and especially in COVID with the struggles that everybody has had, being able to see that doctor or surgeon or getting that surgery done sooner rather than later, mental health wise, physical wise, and obviously continuing on with work does make a huge difference. I think if anybody has any questions for Dr. Shane, Dr. Paulo or Des, Arnold can send them through. But just finally, is there anything else you'd like to say?
Well, I would like to thank you all for the invitation and for the pleasure to be here discussing these very important aspects for all of us. And just say that it will be a pleasure to receive all of us here during the summer. We hope to have a fantastic summer this year. Everything is reopening, and it's with all very good measures, and the numbers are quite low in Portugal now. Thank to 4 months almost without leaving house, and so I think it's going to be very nice next 2-3 months. I hope the figures don't go high again. And I hope the variants are not so resistant to the vaccination. That's another issue that will be facing. But I think in the general aspect, I think it will be very next few months. That's what we'll be expecting for Portugal, and I hope for Europe. Thank you all.
Right, and obviously keep up to date with the Ireland Portugal Business Network.